People don't realize that it's been identified by the American Medical Association since 1956 and then later in 1973 as a brain disease. 85% of the people who go to the doctor with diabetes or hypertension are willing to get help. If you've got a mental health disorder, 50% of the people will get help. But when you have a substance use disorder, only 11% of the people get help. I used to chase things and use people. I love things and use people. Today I'm trying to love people and use things. I used to be more concerned about what was in my pocket. Today I'm more concerned about what's in my heart.
I know, through doing research and just from knowing you, that you work at the Hazelden Betty Ford Clinic and you help people, and you have for like 30 years.
Yeah.
But I think it'd be really great if I could hear the summary from you. Like, who are you and what do you do?
My nickname is Chicago Bob. I got that nickname almost 30 years ago when I entered treatment at Hazelden. I came on to the men's unit and they said, "What's your name?" I said, "Bob." And they were like, "Great. There's like 6 Bobs here, so you're going to be Chicago Bob." And it stuck. It's just kind of a moniker that stuck with me. My whole career has been basically in the technology industry. I was very, very successful really fast at the beginning days of the PC industry. And I think that success kind of caught up with me, and we'll talk more about that, but I made some bad decisions. Amongst that success, about a year and a half after I got sober, I decided it was time to go back into the business world, and I moved back to Chicago to go to work for a startup. At the time, the internet was really just starting up, so I went back to work for a startup internet company and moved a couple times to careers. I ended up going with a company that we ended up taking public that did really well, and I was able to kind of overcome some of the financial consequences I had of my addiction and my time spending in recovery. And then I started a business that I actually started in Minnesota that helped families and individuals avoid some of the mistakes that my family made and that I made. And for 7 years before I sold my company, I think when I talked to my former partner not long ago, he said that we had helped 10,000 families over those 7 years. And then that just kind of teed me up to do some work at Hazelden, and I went on as a consultant. Didn't really want to work there because so much of my recovery, my volunteering, my friends, just my social activity was kind of tied around Hazelden, that I didn't want to make it a career. I don't want to make a job there, Jen. I didn't want to have to get a paycheck from a place that was kind of like a spiritual place for me. So I started out as a consultant, but it worked out. And I just guaranteed that I can't guarantee how long I'll be here, because my passion is really technology and startups, but not a nonprofit who's been here for 75 years. But it's 15 years later and I'm still here. So I'm planning on retiring sometime soon. So I guess I'll end my career here. So it's kind of a nice full circle kind of thing where I got sober. I did a lot of volunteer work, helped some people helped me, and I'll get to move on from here and retire at some point.
So what you do at Hazelden is you help people in their addiction recovery process.
My personal role was on the business side. So my personal story helps people recover because I'm not opposed to putting a face on recovery like we're doing today, right? When I didn't really care who saw me when I was using. So like that addictive self, we don't really care about, but a lot of people, because of stigma, don't want anybody to know that we're in recovery, right? And I figured if I didn't care who saw me use, I'm surely not going to care who knows that I'm in recovery. So because I'm a little bit of an advocate for recovery, I get a chance to go on the speaking circuit a lot and talk about what we do, talk about addiction in the workplace. But my role at Hazelden formally is the business side, where I'm developing the relationships with organizations, insurance companies, other aggregators of patients to make it easier for people to get to Hazelden Betty Ford through a referral source or through financials, or hoping to overcome some of the stigma or denial that happens within the disease itself. My role is to kind of widen the door so more people can get care, either because it's financially accessible or because they're willing to overcome fear and stigma.
Can you just talk a little bit about that turning point from your addiction to getting to Hazelden, just to give viewers an understanding of how do you know when you're at rock bottom? What does that sort of process and turnstile look like?
For me, it was really an interesting journey, Jen, because I grew up, relatively low income on the southeast side of Chicago with the father that was alcoholic. A lot of drugs were around my neighborhood growing up. That working class environment, it was, bar on every corner. I was afraid of drugs and alcohol. I mean, I saw what it was doing to some of my family, some of my friends, some of the people we'd see in the alley. And I didn't want to settle for that, right? So I avoided drugs and alcohol even almost through college. I mean, I drank a little bit in college, but alcohol wasn't my thing. when I got out of college and became successful pretty quick in the PC industry, the personal computer industry, I went to a party once in what was $1 million building in Chicago, one of the $1 million condo building in Chicago. And here I was, kid from the South Side, all of a sudden finding myself at a party where the president of a bank was holding it. And there were some active basketball players and other professional sports athletes. There was newscasters. There was business leader. This one gentleman was the president of a bank. And that evening, he brought out cocaine on a silver platter. Now, in the 80s, cocaine was defined by Time magazine as the new champagne. It wasn't even initially identified as addictive.
In the 80s, it wasn't identified as addictive.
No. They just called it, Time magazine had on the cover called it the new champagne. So it kind of appeared to be the drug of the rich and famous, So now I know by the science of addiction, you don't get addicted your first time you use. But I remember that night, it had an impact on me because the cocaine on that day maximized my strengths, minimized my weaknesses, and played into my grandiosity because I wanted to be rich and famous, right? And here I was in this environment where I'm a business leader and I get to use cocaine. I get to go to all the private, exclusive discos and clubs in Chicago. And I thought it was more a rite of passage. To me, it wasn't the same kids in the alley sniffing glue or drinking or shooting heroin, or these guys that would leave the steel mills and go to the corner bar and then, drink until they were drunk and drive home and repeat it every day. This was different to me. These were the people I wanted to be, not the people I was trying to avoid. So that's how I got started, and then it progresses. I mean, like all addictions, it takes some time. And I can't, I won't lie and say in the beginning there wasn't fun times, right? I mean, if it was horrible in the beginning, I probably wouldn't have done it. But nobody starts out when they use drugs and alcohol expecting to ruin their life, right? You don't think it's going to apply to me. And there's millions and millions of people who've used coke or, drugs or alcohol and never got addicted. And then there's some of us, for whatever reason, the genetic predisposition, our spiritual being, or our mental, psychological, social factors, that some of us get addicted. And once you do, it's progressive, which just means that the more you do, the more you're going to have to do, and you'll get to the point that you can't use and you can't quit. And that's just a progressive nature. And the reason it gets so bad, and this is the part where a lot of people don't understand it, it's something I talk a lot about. I'm often a guest professor in some schools where I really talk about the science of addiction. People don't realize that it's been identified by the American Medical Association since 1956 and then later in 1973 as a brain disease. As a disease and then a disease and then further defined as a brain disease. So you can see in the studies that are done where they take pictures of the brain and you could see the actual change in brain chemistry through the use of drugs. Now, one of the street slangs for drugs is called dope. Right? Where that really comes from is the slang of dopamines. So what happens as you use drugs is it changes the chemistry in your brain that affects rational thought and behavior, impulse, the reward system, and it artificially produces a chemical called dopamine, which is where we get pleasure. Mm-hmm. So when people talk about that first high, chasing that first high, it's never as good as the first high. You may have heard that. That's because you've got all the natural dopamine still firing, and then you add synthetic ones through the drug, so you get an exorbitant amount of dopamines in your system. So you feel that rush, that high, that excitement. But over time, what happens is, as you're using drugs, the natural chemicals start to decline. So all that's producing that feeling is the dopamine. It's the artificial dopamine, the drugs. The same amount of drugs doesn't work at some point, so you use more drugs. Then you change the way you use drugs. Then you change drugs. So when I used to snort it, maybe I now smoke it. If I used to smoke it, now I might shoot it. And maybe cocaine doesn't work, so I need heroin. And it just gets progressively worse. And then we start to lose who we were, meaning that brain chemistry changes, that rational thought, behavior, pleasure system, the reward system. And I kind of define it in a way of, if you think about a committee meeting going on in your head, right? And you're a young boy at a young age, you haven't used drugs and alcohol, and today some guys knock on the door and say, let's play baseball. And this committee is only one person, it's you. And you say, yeah, great, I'll play baseball today. But as you use more and more drugs and you start to lose some of yourself, right, through the chemical change and other brain chemistry, now there's other people in that committee meeting. And today it's not just me. So when my friends knock on the door and say, you want to play soccer, I got to put it to vote. And maybe there's me and there's 3 other people showing up, cocaine, alcohol, and other behaviors. And the vote today says, nope, Today we're not going to play soccer. Today we're going to get high. And the more you do that, the more votes you lose. And that's why families would say sometimes, like, he's not even the same person. And he's not. I might be one person in that committee. And on some days I could win a vote, right? Some days I could say, no, I'm going to play soccer. But a lot of days I lose the vote. And I don't think any of us wake up intentionally that next morning and say, today's the day I want to be a drug. I think we wake up thinking, today's the day I want to rejoin society. But the committee votes. And we lose a lot of votes. And that's where you see some of the anger that goes along with the attempts to kind of control your usage that you lose. And then how I can further define it is if you think about it in 3 stages. In the beginning stage of using substance, you're in control. You've got control over when you start using and when you stop. So like today, if I want to drink, I say, nope, today I don't want to drink. And I can say no. Or I'm going to say I'm going to have one and I'm going to go home. I go to the bar, have one drink and go home. And I would. And I can control that. The second stage is when I still have control over when I start to drink or use drugs. I can say yes or no today. But when I say yes, I'm losing my ability to say no. So the example is I'm going to go for just one drink, or I'm going to stop using cocaine when the sun comes up, or whatever the rule is. I can't. The rules I said I can't maintain because stopping becomes hard. Another common term of that is binge. I may not drink every day, but when I do, I binge. I go out for days. And then the final stage is when you just lost control over when you start and when you stop. You just have to use. That brain chemistry has changed. In some cases, people are using drugs that are physically addictive too, where if you don't use, you'll get sick. Alcohol is an example of that. You could actually die from stopping drinking too fast if you drank too much for too long. So there's a physical addiction, there's an emotional addiction, there's a mental addiction. So that's what you're up against when you're at that stage. And unlike other diseases that once you know you're sick, you probably don't deny it. You usually don't refuse treatment, and you usually want to get better. And you don't think you could do it on your own, right? With substance use, people deny that they're sick, usually, as a starting place. When they realize they're sick, they really don't want to quit. Mm-hmm. Or they negotiate for less than. So if you had cancer, a doctor said you need to get 3 chemotherapies, you probably wouldn't negotiate and say, I only want to do 1.
Right.
With substance use, if they said you had to go to treatment 3 days a week, you'd say, how about just 1 day a week? So we always negotiate for less, not more. And there's a lot of reasons for that. I think stigma is one of these beliefs that because it's will got you into it, that self-will should be able to get you out of it.
Talking about the nature of addiction, for people who think, oh, I'm just having fun, I just, I'm not addicted, I just want to go to a party and get high. Mm-hmm. What are some early warning signs that you'd say that those people should look at? Yeah. So it doesn't become a massively life-changing problem for people. Right. Because I know, like you said, there are people who can use, the term that I've heard thrown around, I'm not sure I know the definition, is microdosing. There's even famous people who talked about microdosing. And I don't know I'm assuming microdosing, and you could probably speak better to this, means mild drug use, regular, but managed?
Well, getting back to your first question, how do you know you have a problem? Here's the easiest way that I can define it for people. And if people are out there and they're listening to this and they're wondering if they've got a problem, here's the simplest one. If you set up rules that you can't maintain for yourself and you got to change the rules as opposed to changing your behavior, that would be the first sign.
Give me an example of what that would look like.
Like I'm only going to use drugs on Saturday night and only every other week. Okay. And then you start using drugs every Saturday night. And then Friday nights. And then you don't stop whenever you say you're going to stop. You keep going. Right? Or I'm only going to drink alcohol. Or I'm only going to smoke pot. And then I stop. Then I also do some coke. Or I do whatever. It's when you can't maintain the rules that you set for yourself. You're starting to lose that control. So I think it's about control. If you have control over when you start using and when you stop using, that's still in that maybe early stage or at risk stage, because using drugs is still risky even if you're not addicted. But when you move to that other stage is when you start to lose control. And you start to see your value system. You start to make bad judgments. You start to hang out with lesser people. You're taking more risks. You're having consequences. Work relationships start to get affected. It becomes more preoccupied with the getting of drugs, the using of drugs, the recovering from using of drugs, recovering of the consequences of using of drugs. The lying and the cycle begins. When you start getting in that cycle, that's a pretty good indication there's a problem going on. And I remember, and I'll never forget this, there was a Saturday night in Chicago, and I was all dressed up, ready to go to the club, and I was driving in my car, and I was listening to a radio station, and just coincidentally, there was a talk show on about drugs, and the guy was talking about cocaine addiction. Now, I don't know what the odds are to call a radio station ever get through to somebody. Like, if you have any questions, call. So I just happened to call, and I asked
This
the guy.
is while you were using drugs.
Yeah, I mean, right during that period, like that night, I was on my way to go, use drugs somewhere, and it was just like one of those, God moments, or whatever you want to call it, where I'm listening to a radio station I always have on that's about cocaine. I dial it and I get through to the guy, right? And I said, to him, I said, well, when do you think you have a cocaine addiction? And he said, when you call a radio station on a Saturday night, ask you if you have a cocaine addiction.
And so, what did you do?
I didn't. I went out. I just remembered it. I never did anything. It kind of stuck in the back of my mind. But I think when you start to wonder if you've got a problem, that's an indication that you might have a problem. And I know you have an audience that's younger. I think what's really important to point out, and something I really try to focus on when I speak to young adults, is it's getting back to this being a brain disease. When you're 25 and under, your brain is still developing. So you're really messing with the neural accelerators, the brain chemistry, in ways that could be really hard to reverse it when you're underage, because that brain development will be influenced by chemicals. Even things like vaping, and using nicotine at a young age, is starting to show in studies now is affecting brain development, the reward system, the dopamine. So when I give a presentation, sometimes I'll show a brain of a young child that hadn't, like a 14-year-old who never used alcohol, and a 14-year-old who drank and smoked pot. You could see the brain chemistry already developing where the neural accelerators in the brain aren't firing as much as for somebody who is using at a young age. And that could have long-term impact. So I think that there is always a consequence, even if there isn't any social consequences, in young people using drugs, because you are impacting that brain chemistry, and it's somewhat of a game of roulette, Russian roulette too. I mean, like, are you going to be the one that gets addicted or not? And then there's a lot of studies that show that grades and performance in school and learning ability are impacted with those changes in the brain early on. So I don't think young people, nor did I. Well, I was fortunate not to use drugs when I was young, but I don't think young people really understand from a science perspective the risk. I think my hope is, I don't know what generations is Z or whatever generation, is anymore. These numbers kind of get confusing. But I think what we see, though, is the current young populations are much more concerned about what they're putting in their body than people like in our age group was, or my age group was. That there's a lot more interest in being sober. There's a big sober movement. There's a big health movement. So I'm hoping that people realize as part of this healthy, being more concerned about what I put into my body, being more comfortable with non-alcoholic drinks, that people will also at the same time do some research about the impact of substance use on their brain, particularly as it's developing, as another potential warning sign for them as they're worried about their health, their exercise, and their eating right, they're worried about the putting in their body. They should also be aware of what role substances play in their development as well.
Right. I want to go back to something you said really early on about you never used drugs. All the way through college, you didn't really use drugs. And you got early messages about, people who do drugs are like on the street. It was a whole different look than what you saw this president of the company coming out on a silver platter. And it sounds like you worked really hard to be successful, and then you made it to this level, and then you saw these people more successful than you doing drugs, and that shifted your paradigm of, wait a minute, people who do drugs are successful, it sounds like. And I'm wondering, why do young people start using drugs? From your experience of the thousands of stories and families that you've met with and stories you've heard from people who've struggled with addiction, why do people start? Why do they go to drugs? I mean, I guess you could probably say the same thing for alcohol.
Yeah, so it's all the same, right? Drugs and alcohol is the same. It tastes differently, but the effect is the same.
Yeah.
Well, I think, there's a couple different reasons. Again, one is peer pressure, right? I want to fit in. And, my friends are doing it, I can do it too, right? So there is the social pressures. That's one of the most common reason people start. But then you run into potentially other issues. One is genetics. Some ethnic groups get addicted at significantly higher rates than others. If you also have family history, if your parents were, have a substance use problem, you have a 50% greater chance of you having a substance use problem. So there's some chemistry, there's some DNA, indicators that would lead that potentially being more susceptible to addiction. So number one is socially using. Number two is a predisposition to becoming more addicted as a result of that. There is also people who are using, where social turns into a habit. I'm getting used to drinking every day. I got a body clock. Every day after school, I get high. That body clock will start to build its own kind of process that creates an addiction. The other one, so that's like social starting it, then it becomes a habit. But the other one is psychological or mental health. There are people who are struggling with mental health issues, trauma, abuse, depression, anxiety, bipolar, who feel more normal when they get high.
What would you say to those people who are depressed or have, mental, emotional challenges of various sorts? What else could they do?
Yeah, I think what if I could see where it's a short-term issue, but then all the rules that we just talked about and all the consequences of substance use play, right? Which is now you have two things going on. Now you have what's called co-occurring. So you've got a substance use and a mental health issue, which becomes more complicated to address. And it's even harder to assess and get a baseline on your substance use because on your mental health issues, because substance use creates a whole new issue, right? So I don't know if you're depressed because you're using because you're depressed, or what the combination is. But I think somebody who is struggling with depression, anxiety, trauma, abuse, needs the same kind of help as anybody else who's struggling with medical illness. Mental health is medical health. There's so many places now that are available online for people to get some confidential help easily, like we're doing right now, where they could get assessed virtually. They could get, establish a clinical relationship, a therapeutic alliance with somebody, even virtually, where they could start to get some really good assessments and really start to understand what's going on and give them an opportunity to work on the mental health component before they have to deal with mental health and substance use. So I think, like every other disease, and I think people try to overcomplicate mental health and substance use. I think all the rules of health apply. The earlier you treat something, the easier it is and less expensive it is. So, and I think a lot of people end up getting addicted to what I would call the accidental addict. Those are people who aren't using drugs in ways that they think it's a street drug, but they're taking highly addictive drugs like some sedatives and other benzodiazepines that are very, very addictive, and it's just really easy to take two instead of one at some point. And if I'm feeling bad with one, maybe taking two gets better. And at some point, they become as addictive as any other drug. So we're taking drugs that are somewhat dangerous from an addiction perspective. In some cases, you still need drugs, but I think therapy is always a good answer to help you overcome some of the really core issues that happen. And then sometimes there is a chemical imbalance in the brain that requires the benefit of some drugs. But I think as part of a total care plan, one needs to really be assessed to what's going on, and then they need a treatment plan developed that will work for them based upon their story.
Do you think the brain can heal, or from your experience in the studies that you've done and in looking at the brain, does it heal from drug addiction after so many years? Is there using neuroplasticity tools or something?
You'll see some of the brain, some of the chemical where you come back, like the dopamine levels will come back. I don't know about where some of the brain activity is stopped. That's a good question, Jen. I got to see more about what the impact is on the actual, some of the areas like rational thought and behavior, how much those come back. But I know the natural dopamine levels will come back without substances. The reason I say I'm questioning on that, because the reward system is one that's a little confusing to me. I'll do some more research on that. Because what is common with substance use is if you've been sober for a while and you go back to usage, you will, in some period of time, pick up where you left off, and it'll get worse. So it is progressive. So there's something still going on even when you're not using. And most of the people that I know who've gone out and relapse have gotten worse before they get better again.
Is that also sort of the cause in, you hear about people who haven't used drugs for a long time, then they went back and then they overdosed. Is it because their physical body is reset to a certain level of what they can take?
Right. So you pick up thinking that you used to use whatever amount, and now you've detoxed and your body doesn't have the same tolerance level, And that was one of the things we saw early on with the opiate epidemic, is that we lost a lot of young men who came to treatment. They were afraid of, before we started using medication to help with treatment, they were afraid of detox because of the pain of detoxing. They were more scared of that than they were even of recovery. But then they may have been sober for a week or two or whatever, and they go out and use the same level they were, and they would overdose, in large, pretty predictable numbers. So it's a combination of that part of the brain that still is drug seeking, that once I'm addicted, and the risk of using again and being able to control it is, I've never heard of it. Now that doesn't mean it hasn't happened. I just haven't met anybody who I know who was diagnosed with substance use, as opposed to maybe thinking they had a problem, but somebody who had a clinical diagnosis who was ever able to go back out and use again socially without it escalating into more consequences. And I've lost a lot of friends. I mean, in the early days, I had 20 or 30 people we hung out with all the time, and more than a few of them have died because they've gone back out again, and the disease progressed, and for whatever reason they couldn't stop. They refused help. People stopped trying to help them. They isolated, and the addiction ended up causing a premature death.
So people who have had addiction problems and then they do successfully recover from addiction, and then they're just in a program for life to not use. When they go back to their life as a non-using person, what attributes or characteristics have you seen are templates for success in them staying straight and clean? What has to change? What new things do they have to bring in? Have you seen any patterns?
Yeah, I think there's a lot of similarities. For me, the hardest part of recovery was asking for help. I mean, just the way I grew up, where I grew up, men weren't really intimate. Guys didn't have a talk on a level that was inner focused, right? I never have ever heard of another man asking another man for help where I grew up, right? So when I was in recovery and got time to be vulnerable enough to ask another person for help or accept somebody else's help, I used to view that as being weak. Now I realize that that's a real sign of strength, being able to ask for help and also being willing to accept help.
Yeah, wanting to improve is always a good thing in any area of life.
Yeah, and I think thinking you could do this all on your own, it's hard, right? I mean, like I couldn't quit using for days or hours, and then the first day I went to treatment, this guy walked up to me and goes, "You're a mess," and I wanted to say "Screw you," but then he was like, "But so we're all of us." And I could help. And this guy probably had 2 or 3 more days sober than I did. But when I'm trying to get one and somebody else has got 2 or 3, that's a lot of days. How'd you get to 1 day? I can't get 1 hour. So I think that the fellowship. I think there's some people who are not in favor of AA, and there's people who don't like Narcotics Anonymous and all that potentially implies. But I think the simplicity of all these programs, it's about relationships. It's about being in a position where somebody who's walked in your shoes could help you avoid the potholes as you move forward, help share experiences and their strength with you, so that you don't have to make mistakes, that you could get hope too, that maybe this program worked for you. And it's those interpersonal relationships that are developed. I don't care how you do it, where you do it, whether it's in church, it's socially, it's through an AA or other 12-step group. The value of the simplicity of one alcoholic or one drug addict helping another drug addict and alcoholic. When people say to me, "I know how you must feel," I'm like, "You have no clue how I feel." Because if you're not addicted, right, or my family or friends. But that one kid, when I went to treatment that one day, within the first hour said, "You're a mess, but we could help." I knew he knew how I felt. And I could talk to people because I've been down that path in ways that they know that I know, and I know how they're feeling, and I know what their challenges, objections are going to be, and what their roadblocks are going to be, and what blocks they're going to run into. So I think being willing to get help is from somebody else beside you is really important. Giving yourself a chance to change, to make it easier for you. Take the treatment they recommend. Don't do less, do more. Make yourself available to show up. So if you're not showing up, people would miss you. Be somewhat accountable to some people, whether it be a group or some friends or some people you met in treatment or a self-help group, where when you stop showing up, people will notice that you're not there, maybe care enough to look for you and try to help you. Recognizing that through the stages of addiction, that once the alcohol and drugs is removed, that's the beginning, not the end of the journey. It really is over time. This is why we call people who have gone through treatment and are in recovery. I'm not only recovering from drugs and alcohol, but I'm recovering up from whatever my character defects were that put me in a position that I started to look for external fixes, which is what substances are, to what were ultimately internal problems, right? And that's how I define addiction. It's the use of external stimuli to take care of an internal problem. Now that could be eating, it could be exercise, it could be gambling, it could be sex, it could be anything that I want to avoid a feeling. So I run to something else to change the feeling, right?
Right.
So what is causing me to need to run away from feelings? Like, what is the core issues? So when I quit using drugs, I put a lot of weight on because I just used food to help me overcome a feeling. I'd get the adrenaline of a feeling and I wouldn't want to feel it. So I'd stand up and go eat. I didn't use drugs. Or when I started exercising or whatever. And I remember I had a therapy session and I told the guy, my therapist, he said something about something else I had to quit. And I said, geez, I quit smoking, I quit drinking, I quit using drugs, I quit eating, I quit gambling. I said, what's left? And he said, why do you got to have something left? That really resonated with me. It's like, yeah, because why do I got to have a thing? Right? I mean, all I got is what I need is myself. Right? So the work I've done since I've been sober, and I think I still do, is really understanding what's making me click. I think I used to worry. I used to know how to look good. I didn't know how to feel good. I used to know more about how computers worked, so I knew how I worked. And I think by getting sober, by working on myself, again, even it wasn't about the alcohol. It was about becoming a better man. And I think through my years of recovery, it's no longer about the use of drugs and alcohol, but it's about doing the right thing. It's about making sure that I'm on my own spiritual journey, that I can establish that relationship with myself, that I know how I tick. I know how to not only look good, but feel good. I know how to show up as a husband, as a brother, as a family member, as a friend, as a business person in ways that's legitimate. I'm less concerned now about how I used to look at life was like a scavenger hunt, Jen. The more I had, the better I was. And that was more materialistic. I used to chase things and use people. I love things and use people. Today I'm trying to love people and use things. And it was a big paradigm shift to myself. I used to be more concerned about what was in my pocket. Today I'm more concerned about what's in my heart.
It's nice. It's a nice message.
And to me, that's recovery is. It's about showing up legitimately. It's about healing, and healing's at a lot of levels. Early on it's physically, later on it's mentally, then it's socially, then it's spiritually. And that's the journey, right? It's that I continue to heal. And along the road, if I could help somebody, if I could make some sense out of my addiction, and if I could help somebody somewhere avoid some of the mistakes I made when those rules were starting to change and I was starting, to violate the rules I set and starting to get addicted, if I was able to help the one out of every 3 families who are affected somehow by substance use to avoid the same mistakes, then it kind of makes some sense to the journey I'm on, right? Like maybe there's a purpose. And I think what you find out over time is that I have a greater sense of purpose today than I had before. My purpose before was to be successful, be grandiose, make sure I had more things. Today it's a different sense of purpose. And not that those things, I don't want those things, but they're not the priority. Because I was really happy when I was living in St. Paul in early recovery, making $5 an hour, too, after losing an executive job. I was just as happy without money, having a lot of friends and doing the right thing as I was when I had, some benefits of a good career. So I realized that chasing things didn't work out. I ended up in treatment in Minnesota, so it didn't work out.
Yeah, that's a great story, actually, a great way to sum it up. I also liked what you said earlier about when you are using, it's like you have a whole team making decisions. It's almost like each drug presents a new team member who's like a voice in your head, working sort of against your own powerful voice, your intrinsic nature or your own voice.
Right, and that's why you lose yourself and you lose the sense of self. And and the other group I just wanted to mention is that families. That's when you look at the number of people impacted by substance use. It's even if it's simplest number, it's 8% of the population has something going on.
Is it only 8%? I would think it's much higher somehow.
That's just alcohol. 1 out of every 12 people is alcoholic. You could add another 4% on to, substance use. So you're talking about 1 out of every 8 people has a substance use problem. If you think about the math on that, everybody has 3 family members. It's pretty hard to find somebody somewhere today that isn't impacted somehow by substance use, either in the workplace or in their home or with themselves. What we're dealing with, though, however, I think is a big stigma crisis, too, because here's the facts. If you believe in addiction is a disease, it's starting there. And you look at other chronic illnesses, which is no cure, but you could live with the chronic illness and get to the point that you get better. If you have a chronic illness like hypertension or diabetes, you go to a doctor. 85% of the people who go to the doctor with diabetes or hypertension are willing to get help. They'll get help. If you've got a mental health disorder, 50% of the people will get help that have a problem. But when you have a substance use disorder, only 11% of the people get help. And part of the reason for that is the medical system isn't designed to really intervene, to intervene. If you go to a primary care physician, they'll take your blood pressure, but if you ask a question about, do you use drugs and alcohol, and you say yes, they may not have an intervention for you. They just might put it in your chart. Your family doesn't know what to do. And you're left to that same sick mind that got you into this problem. It has to be healthy enough to get you out of the problem. And then there's these myths that we hear, like people believe that since you got yourself into this problem, you got to get yourself out of this problem, right? Or you may have heard the one that everybody hears a lot about is that you got to hit bottom before you get better, right? Mm. This is where the stigma and the myths is actually cruel. No other disease in the world would we say that somebody has to get sicker before they get better.
True.
But we hear that, right? Or that
hit rock bottom.
Yeah, the only rock bottom that's guaranteed is death. Normally, we don't hit a rock bottom completely. We bounce along the bottom, right? Sometimes we get bad. Sometimes we win some of those votes. Sometimes we lose those votes. And as we're on that roller coaster, guess what? Our family and friends and workplace goes with us. We have good days, we have bad days, we have good days, we have bad days. And often I hear families they'll define themselves as being held hostage in their own homes. That they're afraid to they're afraid to leave the house because their loved one might use they make deals they shouldn't make. They make promises that they shouldn't make. There's an imbalance of power where the unhealthy family system runs the roost and the healthy family system is divided and a mess. So I think it's really important when there's an addiction going on in the family or even mental health that the family gets help too. Because it probably hasn't been weeks, it's probably been months and years that this has been a struggle. Relationships get destroyed. The good kids or healthy kids usually get less attention than the kids who are sick. We, again, have made promises that we made wrong deals. We do things like, I had a mother not too long ago told me she drives her daughter to the heroin dealer every day because she said her daughter would kill herself if she doesn't.
What advice did you give her?
I said to her is fast versus slow. I said, there's not a long history of life, projected of life shooting heroin. I mean, your daughter's 26. I said, how many 30-year-old heroin addicts we treat? Not that many because they're all dead.
Wow.
I said, if you want her dying in your bed or it's on the street, dead is dead. I mean, don't drive her to a drug dealer, drive her to treatment.
Hi, it's Jennifer Devine, and you're listening to the SuccessFou Podcast. Thank you so much for being here. It means a lot to me. If you're liking the content, let me know by hitting the like button. And if you haven't already, please subscribe, and then you won't miss out on any future episodes. And if there's someone you think could benefit from this information or watching and listening and finding inspirational, please share it with them. Now, let's get back to the show. What's the youngest age you've seen come through to seek services, whether it's at Betty Ford Hazelden or in your own private practice?
The youngest we treat is 12.
12?
Yeah.
And the 12-year-old, at what age did they start using to become an addict?
As early as 10. Sometimes kids grow up in some environments where they have access.
What are some of the trends you see now in terms of age, usage? We hear a lot here in England about the opioid epidemic in America. And I've seen a lot of, documentaries on it. It sounds like, wow, there's opioids on every corner. And I know the media can sometimes hype that up. But what's your real experience been?
Well, with young people, it's actually been marijuana.
Marijuana. It's funny that you mentioned marijuana. I'd love to talk about this. I've heard quite a bit about psychotic breaks being linked to marijuana usage here. Tell me what you know about that and what you can shed light on there.
What we've seen and it's somewhat disturbing with youth right now, is a decline in the number, at least within the traditional treatment environment, a decline in the number of kids that are willing to get help. But we have not seen a decline in the number of kids struggling. I think marijuana has complicated it for families. Marijuana used to be the number one reason that boys would come to treatment. That's not saying the girls weren't addicted, but boys would act out in ways that they got caught more or addressed more. It was illegal. It wasn't as socially accepted. It gave the parents kind of a springboard to take action. What we're seeing now is, because of more and more legalization of marijuana, more generations of parents using marijuana too, that there's a tolerance and there's a belief that marijuana isn't dangerous and it's not addictive. There's a lot of studies now showing, and we still see a lot of kids who come into care who have marijuana use disorder.
What is that?
Just the same as like substance use or alcohol use disorder, that they've used marijuana enough that they're addicted. They can't continue to use. They can't make it through their days without using. They're getting the consequences. But what we're also seeing is what you talked about, is psychotic episodes and health impacts over prolonged use of marijuana. I think one of the studies that was done, which is really interesting, was in Colorado, which was one of the first states that legalized marijuana. And now we're able to see the longer term impact on health, emergency room visits, psychiatric events, the number of suicides by long-term marijuana users. But I think there's still more tolerance for it as a drug, that we're seeing less parents taking it seriously until it has become serious, or it's progressed to other things. There's always been somewhat of this marijuana defiance in society, where kids believe they've got a right to use marijuana, a rite of passage to marijuana.
Is that because it's legal or because it can grow in your backyard?
Legal, can grow in your backyard, it's natural, and all the excuses, that is. But it's so potent now, and then it is having pretty significant psychological and health issues with people. That is leading. It's a gateway for sure for many. The substance type doesn't really make a difference, because the impact on all of us is the same. The ultimate impact, that you'll have a premature death, and we don't know if it's days and in seconds or years, right? But the prolonged use of substance use will cause a premature death, but there'll be consequences in loss prior to that. So nothing gets better by postponing a substance use problem with time. Like, time only makes it worse. So I don't think the drug of choice is as important in minimizing substance use, although there are some drugs that are more risky, but they'll all go down the same path, right? I mean, so sometimes people say, well, I only drink wine, but like I said, when I give a speech sometimes in schools, I'll say, you're a heroin addict, you're a cocaine addict, and you drink red wine. And we all go to the emergency room at the same time. Who do the nurses run to? And they run to the red wine drinker first, because the risk of detoxing and dying is greater than it would be with heroin or cocaine.
See, I think that's one thing that came as a surprise to me. I was watching one of your other public speeches online, and that you said people can die from withdrawal from alcohol use.
Yeah.
I never knew that. I would have thought the much harder drugs than alcohol, heroin, cocaine, whatever, you could die from.
You're going to die because you're not going to feel good, but you're not going to die. But the drugs that people get really sick from detoxing is the legal drugs, like benzos, like sedatives, and or alcohol, because it can cause seizures. And that's
what are benzos? Sorry, what are benzos?
Some of the they would be some of the tranquilizers, some of the drugs that are given by psychiatrists for anxiety, depression. They're highly addictive, and usage of those could cause a withdrawal consequence. So that's why it's not uncommon for us, when people are flying to treatment, say, let them drink. Like, just make sure you get the treatment safely, because quitting drinking too early could cause a seizure, which could lead to injury. There's 3 or 4% of the people that show up at our facility, where we have 24-hour nursing, are too sick that they need to go to the hospital by ambulance as they start the detox process.
Wow.
Yeah. So, like I said, this becomes more complicated sometimes when you look at the health impact of substance use. But again, when people just think it's just alcohol, right? Or my doctor prescribed it,
Yeah.
or that I'm only smoking, or I'm only snorting. Like, it tastes different, affects different, but ultimately the addiction is the same, the impact on the brain is the same. And I think something else that is maybe worthwhile for your listeners to understand is The faster you get higher, the faster you get high from a drug, the faster you will get addicted. So, for example, if you just drank your drug of choice, it will take you more years to get addicted than if you inject it. Because when you inject, you get high immediately. When you drink, it takes.
Oh, I see.
Like snorting cocaine isn't as addicted as shooting cocaine or smoking cocaine. These are progressions within the disease of how you use it, and the drugs you use that get high faster are the drugs that will get you addicted faster. So like a crack cocaine addict, may only take months to get addicted, whereas an alcoholic might take years. Because the rate of which one gets high has an impact as well on how fast somebody gets addicted.
What would you say? You were saying before about statistics, only 50% of people who are struggling with addiction actually go to treatment. I don't know the facts about this, but I've always thought treatment was very expensive. And from prior chats I've had with you, it is quite expensive. So for people who can't afford treatment, and they're not on death's door necessarily, but they've recognized in themselves, wait a minute, I'm not able to say no at times when I think I could say no. So they obviously recognize an addictive pattern. Can they do anything? And what do they need? Give me something that we can give them for knowledge of what they can start to do. Is it pick a few friends, go to an AA meeting? What can they do that isn't signing up for treatment, giving up work or school?
So first of all, let me just say a lot of progress has been made. And again, in the U.S., I don't know internationally, how healthcare has been impacted by substance abuse. In the U.S., when they passed the Affordable Care Act, also known as Obamacare, there was 10 diseases that they identified in Obamacare that the insurance companies had to cover. One of which was addiction, which was a significant milestone in providing care. Because before, when we knew each other socially, there was, I think Hazel didn't take insurance, and it was like $30,000 or something to go there. So it was not available, to many. Today, all of the commercial insurances are accepted by most of the treatment centers around the country, because it was made a requirement of insurance companies to cover it, number one. And that means that people who have employer-provided health care, which is more people have employer-provided health care than government health care, could get care. The government has also provided care. So I think when I said that 50% of people with mental health get help, but 11% with substance use get help, very little of that is cost, Jen. More of that is willingness. But to your question, what can people do? There is a lot of treatment that's available, but it's not a money issue, at least in the U.S., for most people. There's also those who don't have money at all. There's Catholic Charities, there's Salvation Army. There are a lot of organizations in the cities that provide care to somebody who doesn't have it. So treatment's available if you're willing. But if you can't go to treatment, you're not willing to go to treatment in the traditional sense, or you don't need to go away for 30 days to the traditional 30-day treatment program, because that's the far right end of the continuum of addiction. If it's earlier and you catch it early enough, you could do it just like we're doing. We have more people every day who access care virtually from their home. We do it just like this. They do individual care, or it's like a web chat where you're in group with 6 or 7 other men and women, and you're having a treatment via virtual group. The other one is, any 12-step organization where you can show up virtually, you can show up in person. If you donate $1 to the meeting and pay for coffee, it's one of the research will show that it's one of the more effective, low-cost forms of continuing care is 12-step meetings. So money isn't the obstacle. For me, I believe the obstacle, what I've seen, the biggest obstacle is there's a lack of people who know how to help you when you're struggling. As I said, I had a new doctor I went to in Minnesota, and they asked me in the prep for my appointment, are you safe at home, and do you use drugs and alcohol? I said, I'm not safe at home, and I use drugs and alcohol every day. And the nurse or nurse's assistant took those questions. The doctor came in. He didn't mention any of those items. He did look at my blood pressure. Didn't mention those 2 other questions. And I stopped him and said, hey, why did you ask if I was safe at home or if I use drugs and alcohol every day, when I said, yes, I'm not safe and I use drugs and alcohol? And you had no follow-up. There was no intervention.
Yeah. Why was it? What was his answer?
I don't have any resources. I don't have resources for you. We don't, it's a question we have to ask. I'm like, oh my God, when, a third of the people walking in here got something going on, when a third of all the hospital beds are filled because of people directly or indirectly as a consequence of substance use. And as a medical doctor, you don't have an answer for that. That's horrible for one of the largest preventable deaths in the world. So if you're not going to get it from your doctor, and your family probably doesn't know how to deal with it because they probably don't know anybody's ever been down this path before. And if they did, they're probably not talking about it because their own stigma, they're keeping that secret. You're basically left to either Dr. Google, which is really scary. Like I'm going to go to Google and I'm going to find something that could be, who knows what you find.
Yeah.
Or that same sick mind that got me into this problem now has to get healthy enough to get me out of it. Then I got to do research, again, trying to avoid the shenanigans of Dr. Google, to figure out what I might need and where I might go, and then find the willingness to go. So I think that is the challenge that we're faced with, is getting to treatment is beyond finances. It's trying to navigate the entire healthcare system to get to a legitimate provider who can provide the care I need and the continuum of care over time that'll help me get better. I think that's a daunting task because we're typically crisis driven. Something happened today, right, that it's not a great day, and I'm saying today's the day I'm going to get help. Now, what do I do? And where do I go? And I call Google and I find some, guy who's promising me the world, and I might end up trying to go there. But then I realize it's a sham because there's a lot of bad players in the addiction space, or they're asking me to do something I don't know anything about or don't want to do, and I get caught in that analysis is paralysis kind of thing. And then the crisis is over, right? My DUI is a couple days ago. My lawyers are helping me take care of it. I had a scare with my health, but I'm better today. My family caught me, but, I'm able to manipulate them. So I kind of like, crisis is over, I'll wait for the next thing. So that's what happens. Here's an example. If I could get people into care the same 24 hours that they called me for care, 80% of those people get help. Every day that I postpone it or they postpone it or something happens, every day it drops by 20%. So if you don't get in day 1, it's 80, day 2 is 60, day 3 it's 40, day 5 and beyond it's 20% or less. Or then they disappear until the next thing happens.
Do you do any online support groups for people? Do you do it yourself under your own?
Me personally?
Do you have like a list of links where people in that group who can't go to treatment but can do something from their home and want to get better or get help can go to?
I would encourage you just to start by looking at the Alcoholics Anonymous and Narcotics Anonymous online groups that they could find on the internet. If it's legitimate AA, NA group, I think you're safe. I think it's good from a confidentiality perspective. And parents and family members have another one called Al-Anon, A-L-O-N. Al-Anon, A-L-O-N.
Yeah, I'll write it into the post-production process.
Another online group for families too. And Hazelden has, people can come to our website and they could find family groups too. And we also have an online, at Hazelden has an online program for children too, whose parents are addicted, to teach these kids how to be safe, to kind of hopefully interrupt the cycle of addiction in the family. A lot of kids are being raised by their grandparents today, but need to understand why and what happened to addiction. So these kids go through an amazing program where we help them understand at a young age what addiction is, what treatment's like, help them better understand what their families are going to. In some cases, they also need to know how to remain safe because not great things happen sometimes for kids where there's addiction in the family. So some of those resources are on the Hazelden website. Others you can find.
Kids can go to the website and get help without any money. That's great.
And actually, in cities that we're in, kids could come to treatment. In our children's program, not to get addiction, not for their own addiction, but for their parents' addiction, and we cover it all through donors.
That's great.
Yeah. So there's a lot of resources out there. I'll also say there's a lot of fraud too. So I want to encourage anybody who's out there on the internet looking for help. This is an industry that has been tainted by some bad players. But if you find a nonprofit organization, there's a bunch of really well-known places in the U.S. and I know there's a few in the U.K. too that are legitimate providers with a long history. I just do a little bit of research on the people you're thinking about going to before you kind of jump on a plane and go get care or send money to somebody. But I think if you're willing to start by at least having a session, get assessed like you would the doctor. If I don't feel good, go to the doctor, get assessed. Find a treatment center that will give you an assessment that's legitimate, a nonprofit, for example, that's been around for a while. Let them give you a legitimate assessment of what's going on. They'll make a recommendation. Try to follow that recommendation. A lot of it, if you catch it early, can be done confidentially at home, around school hours, et cetera, too. So there's in our case, we have evening programs, we have morning programs, we have, so the convenience of not having to travel. And that works for a lot of people. Some people want some of the social components too. So they'll start maybe in a physical group, and then over time, as they've gotten more resources, more relationships, they'll continue their care in a virtual group, or they'll start in a virtual group but realize that they're missing something and they want to complement it with some face-to-face activity.
So what about those people who relapse? I hear relapse is common, but it's not hopeless. What would you say to someone who feels hopeless because they were doing well, they quit, and then they relapsed?
So relapse is often part of the problem, a part of recovery, right? With any chronic illness. With addiction, I think you'll see a lot of relapses in the beginning, post-treatment, because you get all this education, you start to feel better, you think you got control again. And then you go out and use again, and you find out that all the rules that apply to you, all the rules that you just learned about apply to you too, right? All of a sudden you can't stop using again. So a lot of people will try to test the process. So there's that. A lot of people get in the relapse because they never follow the aftercare recommendation. So like any chronic illness, you have diabetes, you got to change your lifestyle, you got to change your diet, you got to get some exercise, right? You have hypertension, you got to take care of your heart, right? So same with addiction, you got to get treatment, you got to make some lifestyle changes. A lot of people will say, BS, I don't think it applies to me, and then they find out it does. People won't don't do the aftercare, right? And then they get back in the same pattern. The other thing that people have done over time is they stopped doing what worked, meaning that I was taking care of myself, I was doing meditation, I was hanging out with people that were sober, I had a relationship with what we would call like an AA, a sponsor, who's a man or a woman that I feel really comfortable with, who knows my story, who I could say I'm having a really bad day, I got in a fight with my wife today, and he knows the history, which is only an example, but so there's some accountability. I stopped doing those things that kept me sober for a long time. It's not uncommon for people then to fall back into what I used to do before, which is use. So recovery is often part of the process. We could never sign off on it because there's a lot of people who don't make it back from a relapse, right? So you can't condone it. But if you can learn from it and you can learn what mistakes you made and you could use that to find additional motivation, then there is some value in learning from a relapse. I've seen a lot of people who relapsed once, again, seeing that the rules applied to them, but then they never drank again. I also know a lot of people who have never relapsed. I've seen people that have had 20 years and relapsed. But I think the message that we've given everybody who's relapsed is don't let shame keep you sick. If you relapse and you made it out of a relapse, start doing the things that you were doing that worked. And if you didn't do anything, start doing the things that was recommended of you in the beginning. If you were doing things but it wasn't enough, then do more, not less. When you reach the level of addiction that you need treatment and the things are starting to fall about, addiction is a full-time job. Using, recovering from using, planning to use, create that whole process over again is a full-time job, right? Planning to use, using, recovering from the consequences, starting the whole thing again. That's all you could do. It's a full-time job. Staying sober is a lot easier than chasing that.
Good.
It's just the beginning. It's hard. That first year, and if you could avoid that relapse for that first year, and avoid getting worse before you have to get better again, it gives you that time for that brain and everything else, some of those other chemical things to improve, for you to develop a support system. Early recovery stinks because it's about loss, right? I may have to give up my junkie girlfriend. I may have to give up my job as a bartender or whatever, my story was. I may have to move to Minnesota for a year, right? It's not being in Chicago. Addiction is about losing things. Recovery is about getting things back. And in that interim period where you just get out of treatment, you're still kind of in that lost stage. I've lost things, right? I haven't really gotten the benefits of new friendships, a new way of life, hope, because that takes some time to get that. So I always try to encourage people, to stick with it. Nothing's going to be as bad as your ending days of using, but you'll hit some days where you'll hit a door or hit a wall in recovery. It's not about how many walls you hit. It's about how many doors you make into those walls, how many times you walk through them. And don't judge your recovery by hitting walls. Judge it by how many times you've walked through those. And eventually it'll become easier. So, you used to get cravings that would, happen once or twice a day and they'd be intense for a while. But if you sit with it, you can work through it. But if you use, you go backwards. Over time, I don't get a craving at all anymore. I never think about it. It's just not part of my, it just I mean, it's been. I mean, I haven't had that problem for many years. I mean, I've been sober for almost 30 years, but it was like 2 years in, I wasn't having, less than that. In a year, I wasn't having cravings, and I wanted to be safe. I mean, I just avoided. I didn't make it harder for myself, which means I didn't put myself into situations where it'd be more difficult. Like I didn't go to parties where they could be drinking and drugging. You know, I didn't want to hang out with people that were using, even if I didn't see them use, because I don't want to see them, wiping the nose. I just avoided. I live in downtown Chicago, which is right in the bar scene. Like I didn't, where I used to hang out. When I moved back to Chicago, I didn't walk down the street where the bars are at. I took a U-turn around it just to avoid, to make it easy. And I think that's, I just tell people, give yourself some time and distance from where you're using environment to get better. And then every day, we talk about one step and one day at a time. Every day it gets easier. Every step it gets easier. And just give yourself time to get better.
And thank you for that. Do you have to change all your friendships?
I changed all my unhealthy friendships. In my good friendships, though, I gave time to work it back in. Initially, for about the first year, I just stayed away from everybody.
And so what did you do socially?
I hung out with new people who were sober. And I did things like I never thought I'd want to do. Like I didn't like picnics when I could use the picnics, but a bunch of people got sober picnics, and I did that. We hung out a lot and did movies and just things that I guess normal people do. So I kind of rejoined society slowly and did healthy things with other people. So I didn't become too tired, too cold, too old, too young. I try to avoid the word too hungry, too angry, too lonely, too anything by myself. I was just try to become little by little rejoin society as opposed to being susceptible to the isolation that's caused by addiction.
And how juicy is life now? How juicy has the last 30 years been?
I think I'm in so many ways different than I was before. I really do think I'm a better person now. I still look at it as a journey. Jenny, when you get a chance, if you want to put a link out to this, put a link out to something called the Jelinek curve, Jellinek, I believe. The Jelinek curve is a famous path of substance use and recovery that was done by the psychiatrist Jelinek, who studied addiction. And it shows you the predictable path of addiction and the hope of recovery. I'm clearly on the path of the hope to recovery, where you are able to establish new relationships, you've developed a new meaning, you've developed a new relationship with yourself. I think that I'm at that point now where I know myself better than I've ever known myself. I know what makes me tick. I know what causes me a lack of serenity. I understand the meaning of the word serenity now. I know how to find it. And I still think there's opportunities for me to continually improve on myself. And I'm open today to have relationships that are intimate with people that I care about, that I could be more open. But I think the area that I still need to work on the most is being more vulnerable.
Don't we all?
Yeah, I remember people used to say be vulnerable. I don't even know what that means, let alone be it. So
society doesn't set us up to have that be a very comfortable place for anyone anywhere.
Right. Yeah, you admit it, you being more humble and as well being just another area of I try to show up legitimately every day and kind of do more right than wrong. And in the steps of Alcoholics Anonymous, there's this tense about make amends when we kind of screw up. And I really try to live my life in that way that if I screw up, make amends and own my side of the street and do what's right on my end, and I think things will work out. And like I said, now I'm not trying to use my emotional intelligence in ways that manipulates people. I'm not trying to use people to advance my whatever my motives were. I'm trying to kind of just do the right thing, I guess. So.
Brilliant. It's all any of us can do.
Yeah. I got great relationships now. I'm happily married and
amazing.
Yeah, which I didn't think was possible. I couldn't get out of my own way long enough to have meaningful relationships or get out of my own way or get married. So I think it's all part of that recovery process. I never wanted to be an alcoholic and a drug addict, but today I thank God I'm in recovery because I think it's made me a better person.
Nice.
Yeah.
And how can people and families be better allies for their loved ones who are struggling with addiction? Their kids, parents, siblings of people who seem to be struggling with addiction, or friends that you might have struggling with addiction. How can you be a better ally? And
That's a great question. I think number one is understand the disease. Number two is there's a lot of resources for families and friends to get some help and so they can understand it and understand how to best support somebody. I think it's important to let that person prioritize their recovery. Now, I realize there's a lot of damage in a family. Like, like to say that I was an alcoholic and my wife had to take care of the kids for all these years and had to take them to all the soccer games and do all that work. And now I come back from treatment. She's like, now I want a break, right? And you take the kids to soccer, but maybe I need more time to go to my AA meeting. Maybe I need to take care of myself. So I think it would be respect the fact that I have a recovery journey that needs to be a priority, because if I put anything else first, I'm probably going to lose it all again. So, respect the fact that we're sick, that we still need time. Respect the fact that you've had some challenges living with somebody that's alcoholic. Get some help for yourself. Understand the disease, but be supportive of the recovery. Understand what that is. Ask that person what they need from you to be supportive. I think it's also a two-way street to make sure I understand what you need too. That we have that open communication. I think trusting us, but there's that but we have to earn trust back. So having that open conversation about how are you going to feel comfortable about what I'm doing. So I've lied for years as a drug addict and alcoholic, right? And now you're my wife, and I'm coming back and I'm thinking the world's great, and she's probably saying, I probably don't trust you yet. How do you have that conversation? How do you as my wife, get comfortable that I'm doing the right thing without having to be the policeman? Right? And how do I need to have you trust me without you following around me snooping? So you have that communication about what's the best way to be accountable. How do I make sure you're taking care of yourself without being the cop to make sure you take care of yourself? What things do I still need you to show up for as a priority with me? I think those open communications about the damage that was done during addition to this trust I have with you now, and how do we both get back to that place of trust, and how do I help you recover, but also how do I not enable you either?
Yeah, and how do parents not enable their children? So if you're a parent and you have a teenager, a college-age student who is using or experimenting, they might have even told you they're experimenting. Of course, any parent would worry for the health aspects, the addiction fear aspects, the throwing your life away early, brain damage, all of it. What should parents do, say? What position should they hold? I mean, for many parents, their children are adults. Yeah. They don't live at home.
The biggest thing that families do wrong is the conspiracy of silence.
Good answer. Tell me more.
It's like that they pretend that nothing's going on, or they'll say, I won't tell your father if you promise not to use again. Or just between you and I, we're going to drink together, but don't tell mom. Or that, or it's okay, mom is, or the divide and conquer where mom's just overreacting. I drank when I was young too. So that not talking about it at all, get together as a family and talk about news, weather, and sports, not talk about things that are important, right? Or you're not together at all because there's no meal together, there's no time together to have these conversations. Or we're making side deals, right? Like go ahead and use on weekends, or your mom's crazy or whatever. So that's one. The second one is when the person who is using starts to disrupt the family system by causing chaos to makes it really unpopular or unpleasant for you to raise the issue. They'll cause a fight, they'll cause separation. So I think what's really important is don't keep secrets from each other. The conspiracy of silence only gets everybody sicker. Don't let somebody who's sick divide the family, divide and conquer. Eliminate the weak links. So if there's somebody in the family that your child would run to, like an uncle or an aunt, a brother or sister, break that chain of the weakness so that they don't get the one person signing off on their behavior like your mom and dad are overreacting. It's fine. Set boundaries on what you expect or not expect in your own home. Meaning, if you don't want your child to use, then set that rule that's not acceptable. But ultimately have the courage to say no. It's not okay. And to put consequences in place that you're willing to maintain, and make the deals that are healthy deals, not the unhealthy deals. And draw that line in the sand that says this is what is acceptable and this isn't. And if you cross this line, here's the consequences. And you have to define what those consequences are, whether it be treatment or privileges, right? I mean, the power of no is amazing. I owned a company that helped families in those situations who may have been caught up in this for years and years and years. But in a couple-hour meeting with them, where I asked them kind of what you've seen, how it scared you, how it's impacted you, and what you're willing to do to help somebody recover, but also what you're not going to do to enable them. If I can get them to identify, what I've seen, how it's affected me, what my fears are, what I'll do to help you, but what I'm not going to do to enable you. And I can get the family on the same page, that there's talking on that basis of love and concern and dignity and respect in ways that's not going to raise defense mechanisms, but it's going to make really clear that the healthy system is going to help you make decisions. And depending on how old you are, if you're an adult, you get to do what you want. Ultimately, your kids get to do what they want, right?
Yeah.
They can be the best drug addict they want, but the question is, are you going to make it easy for them? Are you going to contribute? So in family addiction, they'll say that the family didn't cause it. They'll try to teach the family that you didn't cause it, you can't control it, and you're not a cure. I added a fourth one, though, that says, but you can contribute. Like the mother driving her daughter to the heroin deal. The father hiding the fact that he knew that his wife drives the kids to school, picks up the kids from school every day, including the neighbor's kids, drunk. I mean, there's stories, a gazillion of them over the years. But we keep that secret, right? We don't, and when we do that, we keep everybody sicker. So I think when you're able to say to a family in a very powerful way that we love you, we've seen this behavior when I've watched this is how it's made you, this is what we've seen happen to you. When it happens to you, I love you as my mother, but moving forward, here's what we're not going to do, right? Here's what we'll do to support you, but here's what we're not going to do. We're not paying your bills. We're not getting you out of jail. We're not letting you, whatever it is in your world, like, right? You know, I'm not driving my car like I was with the family once, and their consequence was, if you continue to smoke pot in the house, which he was doing right in front of him, we're not going to let you drive the car anymore. The kid went upstairs at a bi-level, went to his room. We were sitting there talking to him. He came down. He threw the car keys down to his parents while he lit up a joint.
Oh.
And they were devastated. And I'm like, why are you mad? That's the deal you made. You said to get smokes pot, he can't drive the car. He was okay with that deal. So he smoked pot. Now that we
have a stronger deal.
Yeah, it wasn't the right deal, right? So I think it's about setting those boundaries about what is acceptable, unacceptable behavior for you, and having the courage to maintain those boundaries.
That's great. Now you've written some books. Is any of your knowledge about this or helping families and helping addicts in a book that we can reference that people can go buy and get?
The book is still available on Amazon. It's called "It's Not Okay to Be a Cannibal: How to Stop Addiction from Eating Your Family Alive."
Oh, that's great. And I'll put in a link and maybe
And that's the analogy with the cannibal is, if, like, despite all this, the family craziness, right? And signing off on behavior, moms driving kids to the dealers, etc. If your son was a cannibal today, right? Like, that's so taboo in society. Like, you wouldn't make a deal with him if you only eat people on Saturday nights. I won't tell anybody, or I won't tell your father, right? At some point, you're going to turn him in, right? So we get that there's something bad enough that you would say at some point it's not tolerable, right? But when you think about the cannibal, the addiction, it really is eating my family alive, but inside out, right? And outside in, that it's not okay. And it's not okay for the kid to be smoking pot in the house. It's not okay for the mother to be driving the kid to the dealer. It's not okay for the sick kid to take all the college funds from the kid who's a healthy kid. You know, it's about setting these healthy boundaries. It's about giving families the courage to say no. And I think if that's the magic word that I've seen happen over these 10,000 families that we've helped, when we've gotten families on the same page, and they all shared what they've seen, and they all get rid of the secrets, and they all share the risks and the things that, like, I dealt with a pilot's family whose mother and sons and family said, well, Dad would never fly the plane drunk. And the other kid said, I gotta tell you the truth, Dad's been flying the plane drunk for years, and last week he took the grandkids with him when he was drunk. So, like, you get these meetings where people start to tell the truth, right? When you learn the truth and you set a boundary and you give the people the courage to say it's not okay anymore, just that ability to stay with that no for 24 hours could change families who've been stuck for years, because the paradigm has changed. The power has changed. The healthy gets the power back. And I think that's what we try to do is, however we got where we got, today's the day we're drawing a new line in the sand. And today the healthy family system is going to offer love and support and do all we can to help you, but we're not going to do anything any longer that makes it easier for you to use. The old saying sometimes is you could love somebody to death. I think that's true with families too, that sometimes you got to push them away to get them back. And sometimes you got to have the courage to say no, because if what you're doing isn't working, more of the same probably isn't going to work either. And I've seen 99% of the time that when a family has the courage to say no and they stay committed to it's not okay, here's how we're going to support you, but here's how we're not going to enable you. If they have the courage to stay with that, if they're able to stay strong before and not relapse before their loved one does, by backing off the deal, they're able to move people into care. And what's really important too is how you get to treatment isn't important. Your willingness to go to treatment isn't important. Every day we have people show up at the door and put cash down and say, I'm here, I'm ready to go. And we have people who are dragged in by the police, or court systems, or their family did an intervention, or their employer said you got to go to treatment, who were not willing. So every day people show up with different degrees of willingness. Your willingness to go to treatment isn't important. What's important is your willingness when you leave treatment. Getting people there is the first step. So if we can get people to treatment, whether we've got to negotiate with them that says, I'm not going to pay your rent, I'm not giving you money, you got to go find somewhere else to live, or whatever your boundary is, whatever those motivators are that I'm willing to put in place and not back away from, has a good chance of getting people to care. Because consequences do motivate people. To get help. If I could use without consequence, why would I stop using?
Yeah.
But I want to give them consequences I control so that I'm not susceptible to consequences we don't control, like the police, like health, et cetera, right? Financial, legal, medical. If I can move people to get them a chance to get into treatment, to start to see clearly, to get some time with them, to start to feel better, to get some hope, to start some healing, then I got a chance. So that they could leave treatment more willing than they were when they got there. And that's the hope, just to do the next thing. But we got to get them to that point to give them a chance.
Is there anything else you want to leave young people with? I guess 12, I have to say 12, I was going to say 14 to 20 year olds, 12 to 20 year olds who are experimenting and getting high and feeling like they need it and like it, and their friends do it. And I live in London, and I see there, people walk down the street and I can smell, it's not legal here to smoke marijuana, and I smell it all the time. Young people drink here. The legal drinking age is 18. There's a lot of kids who get fake IDs at 15, 16, 17, drink. It's a drinking culture. What, if anything, can you say to these young people? Any final words of wisdom? And what I'm going to walk away with from this meeting with you is secrets keep people sicker. Is that what you said? Yes.
Yeah.
Secrets keep people sicker. I love that. Yeah. But anything else you want to?
As a kid, I think that people are going to experiment, right? So I would say number one is have the courage to say no.
Nice.
Number one, have the courage to say no. It's somewhat of a game of Russian roulette. You don't know if you're going to be the person who isn't impacted or the person that is. But in all cases, no matter what, you're taking a chance on your brain development that's going to impact your future ability to learn and also control your reward system and control behavior. So even if you don't become addictive, you're impacting your brain. I would say if you're going to experiment, wait at least until you're past that brain development age of 20-something, because right now everything you do is going to potentially impact you for life. And it's just not worth it to fit in. And in today's world, more and more people are getting more sober curious, with big sober curious movements, that I think there's more people behind saying no than saying yes. But it's risky. It's like I said, you're taking a risk when you do it. And you have the power to say no.